Hi everyone, I'm Sean, this is Amy, and we're from tails.com. We're here to celebrate Veterinary Nurse Awareness Month and the wonderful role that veterinary nurses like Amy play in clinical practice and in other areas of the veterinary industry. So welcome Amy.
Thank you.
Thanks for coming. From my perspective as a vet, I just really want to celebrate the role that vet nurses play, and they've definitely had a big impact on my career, especially when I was a little baby vet just out of college. Vet nurses helped me a lot develop my skills and confidence as a vet, and I think actually vet nurses are very underappreciated and sometimes misunderstood what the role entails. So we want to talk to Amy about her perspective of being a veterinary nurse and kind of what that means to you. So what does being a veterinary nurse mean to you, or what does the job entail?
Well, what the job entails is almost anything and everything. You know, vet nurses, we're almost a jack of all trades, so you'll find us pretty much in every area of the practice, helping, supporting not only our patients, and that might be through sort of consults, through reception work, through taking blood samples, making sure they're settled in kennels, you know, monitoring them while they're staying with us, through to assisting with surgery, whether it's anaesthesia, carrying out minor operations ourselves, which we can do as well, whether it's in sort of the radiography room, ultrasound. You know, we find us in every aspect of the practice, and we'll be there supporting our colleagues as well, whether it is baby vets that are fresh out of uni, whether it's student nurses, our care assistants, our reception team, and our clients, you know, our pet owners. We're there for every single one of them.
I think, you're definitely jack of all trades, and you're often kind of whizzing around behind the scenes in a practice and getting things done. Definitely helping us out in the consult room, you know, with bloods and tests and inpatient care. I think the commitment that all the veterinary nurses I know show to patient care is something that doesn't get seen by the public, but really needs to be celebrated and acknowledged, I think.
Definitely.
And I think client care as well. Like, often as a vet I would have very little time between consults to really talk to clients, and I think your role often is as a counsellor for clients as well, talking through their problems and worries about their pets.
Yeah.
Can you talk about that aspect of veterinary nursing?
So owner education is one of my favourite aspects. It was while I was in practice, and it is even now. And it's being there for our customers, having that time to often talk to them as well, because a lot of customers, they'll come out, as much as they love the vets can almost be a bit scary to your average pet owner, so we can come and take a little bit of that fear away. We've got maybe that time to actually spend talking them through what the vet's already told them, maybe even putting it into language that they actually understand a little bit more, and they're supporting them while they make those decisions for their pets, you know, whether it is maybe the right time to neuter, whether it's actually looking at maybe end-of-life care, what we can and can't do, and helping them and supporting them when maybe that time comes and they need to make that decision to say goodbye. You're
often helping them with difficult decisions, right, by talking them through it again and answering questions on the phone that they thought of after they've left the clinic.
That's it,
yeah. Why did you go into veterinary nursing? What's your story?
So for me it was pretty much as unscientific as you can get. You all go through school, you get to a point where you kind of got to start thinking about what you're going to do for the rest of your life, and I'd always loved animals, but I'd also always loved ancient history.
A little bit different?
Yeah, just a wee bit. So I couldn't really decide what it is I wanted to do with either, so I pretty much sat down and went, eeny, meeny, miny, mo, animals fun. So then I kind of started looking at, well, what can I do sort of within the animal world, as it were. My mum's a human nurse, and I'd always spent time sort of in and out with her and her job often, so I was quite familiar with that side of things. So for me it was almost a natural step to combine the two, to combine nursing and animals.
Love animals as well. Yeah. And how did you train? There's a few options to train as a veterinary nurse. What are the routes that people can take if they're interested in that career?
So, well, back in my day it was more degree versus sort of MVQ, well, not even so much versus, it was just whichever you preferred to do. Nowadays there are three main options, so you can do the diploma route, which means you're in practice and you generally get 1 day out to then go to your lectures and study.
Right.
You can do the foundation route, which is a slightly shorter course, similar to the diploma in that you've got a good mix of actual study versus sort of being in practice. And then you've got the degree route as well, which in my day was a 4-year course. I think for a lot now it's been condensed down more to 3 years.
That's full-time study?
Full-time study, yeah. You're either in full-time lectures, back-to-back, so not necessarily the typical student life you might expect.
It's not a walk in the park.
Definitely not, no. And then if you're not in lectures, you're pretty much out in placement as well.
What kind of placements did you do?
So really varied actually. I was really lucky that for me it gave me that exposure to all the different types of veterinary practices that are out there. So from sort of one-man band type practices through to larger ones, mixed practice, referral, exotics, wildlife, charity. You've such a variety out there, and they all kind of have slightly different nurses that work there as well, so it was really good to get that exposure.
Got kind of broad exposure to all kinds of career options.
Yeah.
And then in terms of your veterinary nursing career, where did you start and where did it go? What did you do?
So I was very fortunate in my final placement, just before I graduated, I actually ended up in charity. I started working on my placement for PDSA, and it was one of those options where I sort of walked in the doors and kind of knew I found my place, found my home. So I really stayed with them then after graduating for sort of a good 6 years.
Yeah. And what appealed to you about PDSA in particular?
Do you know what, that's a really hard one to answer. It was just, I think for me, at heart I am a charity nurse, so for me it was knowing that I was making a real difference to those particular patients' lives, animals who wouldn't necessarily get that helping hand for whatever reason. And not that nurses in private practice don't do that, I think it's just a slightly different form of satisfaction. And for me, I felt at that time I was getting to use my skills a lot more than potentially some of my classmates had been and stuff as well. So yeah, just great satisfaction from it, and obviously a great team to work with.
And you worked in the PDSA clinics, but didn't you also travel around as part of their outreach, community outreach? Yeah,
so after 6 years in hospital, I kind of decided that I wanted to do more with what I was doing and pursue sort of that education side that I've already said I love doing. So yeah, I transferred to their community and education team. There were 5 of us across the UK, so we had a lot of travelling to do, but it was great because it meant we could work with dog wardens, local dog groups, we were working with local schools, promoting responsible pet ownership, and really just raising that awareness and helping again improve that animal owner bond that people have with their pets, and make sure that they're able to do the right thing by their pets as well, from simple things of children, you know, dog bites can be such a big issue. And educating them about the best way to approach dogs and things.
Body language.
Body languages, why rabbits need a friend and actually shouldn't just be this solitary little creature down in the hutch at the back of a garden.
So making a big difference to animal welfare and like future generations of pet owners as well.
Absolutely.
What would you say is your biggest love of being a veterinary nurse, registered veterinary nurse?
Oh, that's a good question. Ultimately making a difference within practice. Apart from my sort of nurse consults and weight clinics and things, I absolutely love dentistry.
Yeah?
Yeah.
Your third career after ancient history and veterinary.
Dentistry, go figure. Yeah, I'm never happier than at a top table.
Great. And what about then on the flip side, the biggest challenges of being a veterinary nurse?
I think the biggest challenge is, it sounds odd, but dealing with humanity in a way sometimes, because you've got to overcome people's own personal health beliefs, potentially different cultures, religious beliefs and things, and from where you're standing can sometimes feel like they're getting in the way of you being able to provide the best patient care. But it's not anything that's done sort of generally deliberately or anything like that.
It's communication challenges, isn't it, that everyone has?
That's it.
Where you have a vet nurse, owner, pet, sometimes you have to all be on the same team for the animal's welfare. Can be difficult sometimes. So then you left PDSA and you came and joined tails.com.
After a year of locuming?
Yeah, what prompted that move?
I just got to a point where again I was looking for a new challenge, and I sort of took that year out to locum to really work out what it was I loved about being a vet nurse. And it ultimately came back to the fact that I loved client education, I loved talking to my customers, but more importantly I really loved the nutrition side of things. So actually if I had a nurse consult that was anything to do with nutrition, whether it's an overweight pet, diabetic clinic, something like that, senior pets, I just love being able to talk to customers and seeing, you know, what's working for them, what's not, because it's not a one size fits all by any means. And I think Tails offered that opportunity to follow nutrition, but actually follow it in a way that it was tailored to each individual dog. It's not a case of this is what we've got and this is what the next 10 dogs are going to have. And having
individual based, and what about your current role now? Can you tell us what you do currently in your role for Tails?
Yeah, so what I do now is I actually sit sort of within our customer experience team, so I still get to talk to my customers, and I help support any of those queries that actually do come through to us. So it might be that they're dog maybe has become diabetic, so looking for a bit of support, or it could just be, for whatever reason, their dog keeps getting loose stools. And we know full well what dogs are like. They like to scavenge as much as anything, but actually they can be allergic, they can have intolerances as well. And people often focus on food as the first port of call, which we can deal with, and we do, but it's then giving them again that extra level of support on top of that as well. So it's like, okay, we've looked at your food, but actually, have you thought about what else your dog might be getting, who else might be treating your dog and things like that? And getting people just to think about the wider picture.
Yeah, one of the things that I really enjoy working with Amy, lots of things I enjoy working with Amy, but one of the things is how we provide a lot of the education in-house at tails.com. For everyone who comes on board, we do a bit of training on all things dog related, but then Amy leads up all things nutrition related as well, just so that everyone working here really has a good knowledge of dog nutrition, or a base knowledge of dog nutrition.
Yeah.
And training our customer experience specialists as well, and how to answer our customers' inquiries. That's a really rewarding part of my job, and I guess yours as well, right?
Yeah, it is. It's lovely when you overhear conversations and you know they're giving the right information there, and the customers go away happy as well.
Definitely. All right, well, thanks so much for talking to us. As I say, it is Veterinary Nurse Awareness Month, and we really want to champion and celebrate veterinary nurses. Amy is amazing, as are many other veterinary nurses. She's my partner in crime for sure, and helps me out a lot when I'm stressed and have too much going on. So yeah, really get behind Veterinary Nurse Awareness Month. If you do want to find out more about it, you can go to the BVNA, the British Veterinary Nursing Association website, and they have lots of information on there. You can also look up the hashtags that Amy has prepared. So
we have hashtag Planet RVN, and most importantly, hashtag It's What VNs Do.
So if you want to learn more about the veterinary nurse role, have a look at those hashtags, What VNs Do and Planet RVN, and join us soon for some more videos with myself and Amy. And then if you want to as well, I really encourage you to like our new page, tails.com/vet. Thanks a lot. Bye.